World Hearing Day, and WHO is releasing its first ever report on hearing. I'm so pleased to be joined today by Dr. Shelly Shatta. Thank you, Shelly, for joining us today.
Hi,
You're
Chris,
very busy these days, getting ready for this report launch tomorrow.
Yes, indeed.
You're our technical lead in our team that works on ear care and hearing loss prevention.
Yeah.
Thank you so much for joining us. I wondering if you could tell us a little bit about the report that we're launching tomorrow.
Yeah, thanks, Chris. So this report was requested by our member states in 2017 during the World Health Assembly as a resolution was adopted. And this report, it is really a summary of what is the current status of ear and hearing care in the world. Not a country-wise summary, but more a summary of what is the global situation, how many people are there, what are the projections, what's going to happen in the future given the current trends, what is the cost, what is the economic impact, what is the social impact, what is the impact on individuals of such hearing loss, what is available in terms of solutions, and how those solutions can now be made accessible for people who actually need those solutions. Because what we see is a huge need. We see also that we have many interventions, very effective solutions, implants, sign language, hearing aids available, but there is a mismatch. People who need them don't have access. So this report is really about how can we bridge that gap.
Thank you so much. I'm wondering if we could dig a little bit deeper into what is the problem. If you could tell our viewers what exactly is the issue that we're looking at and how widespread is it, and what countries are most affected? Is it a global issue, or is it limited just to some countries?
So indeed, it is a global issue, and it is prevalent across the life course and also across the entire world. We do see that, if we just talk about numbers, what we see is that there are about 1.5 billion people currently who have some level of hearing loss, and out of these, about a third, nearly a third of them, they require hearing rehab services in order to have, good day-to-day functioning, so they can go and sit in a restaurant and have a good conversation with their friends, or go to a meeting and be able to hear clearly. And this number is likely to go up to 2.5 billion by the year 2050. That is what the trends predict. Well, majority of this, the people with hearing loss live in low and middle income countries of the world. However, we find that the prevalences are high, both across all income groups and also across different age groups. The highest prevalence is, of course, in people who are older, which is not to say that it is not a problem in adults, in younger adults, or in adolescents and the youth, because that is also a trend which is currently emerging.
Excellent. So thank you very much, Dr. Shelly. If you're just joining us a little bit late, this is a live event coming to you from Geneva, Switzerland, WHO headquarters on the eve of World Hearing Day. And today we're talking about hearing loss and hearing loss prevention as WHO releases its first ever World Report on Hearing. So you're talking about an issue affecting people around the world, and the numbers are increasing. Why is that?
So the numbers are increasing because, well, we are more people in the world, so the world's population is growing. It is also aging, and thanks to all the medical marvels, we are living longer, which is wonderful. But that also means that we have these functional declines to deal with as we grow older. So we are more and we are living longer. But it's also because there is a persistence and even a growth of some of the risk factors which can actually be controlled, which can be completely prevented. So ear infections are one. Chronic ear infections, they affect about 200 million people globally, mainly children. And this causes hearing loss, which can be completely treated or prevented through medical and surgical means, through interventions. At the same time, what is increasing is the risk of hearing loss, which is caused by exposure to loud sounds. WHO estimates that there are over 1 billion young people who are at risk of hearing loss simply because of the way they enjoy their music, listening to music over headphones or earphones or in entertainment venues. So when they do that at loud volumes and for long times, it puts their hearing at risk. So it is this combination of well, the rising population, but also the fact that we are not fully being able to control these risk factors, which can actually be prevented.
Thank you. If you have any questions, don't hesitate to put them in the comments field if you're watching on YouTube and on Facebook and LinkedIn. On Twitter, if you can use the hashtag AskWHO, and then our team that are looking at those will get those and get those questions to me on my phone. You'll see me looking down at my phone from time to time, and that's how I'm taking some questions. And they're starting to come in now, so thank you so much for everyone. People are interested in, can hearing loss be prevented? You touched on this a little bit. So what would your main points be for our audience on how to prevent hearing loss?
Yeah, so a lot of, and this is one of the messages of the World Report on Hearing, that hearing loss, or at least a lot of it, can be prevented. And today we do not think that hearing loss is a natural consequence of aging, because across the life course there are many factors which put us at risk. Personally, we can take responsibility for our own hearing, firstly by good ear hygiene. I'll tell you a simple thing. We are very fond of putting ear buds into our ears and trying to clean them out, but actually that's a practice which is, though fairly common, is shown to be harmful, and it can lead to ear infections, it can lead to wax accumulation, so everything which ultimately will lead to hearing loss. So that's a simple thing we can avoid. Along with that comes the part of protecting our ears against loud sounds. So these are interventions we can do at a personal level. So if you're going to a loud game, for example, or you know that you're going to a party where it's going to be loud, you can use earplugs. If you're listening to music over your headphones for a long time, there are a number of apps which are currently available. As a matter of fact, WHO has made a recommendation for all smartphones and devices to have such apps. It's given the specifications for these so that people can know how they're listening, they can monitor, and they can mitigate their own risk. So these are actions which can be done at a personal level. Then of course we have the public health actions. But
let's talk a little bit public health actions, because we have a question from a Facebook viewer, Mike Engeloff, who's talking about insurance and perhaps if hearing loss devices can be covered under medical care. Yeah. So if we're looking at WHO's work in terms of universal health coverage, making sure everyone has access to health care, is that something that hearing loss prevention and hearing loss tools can be included in?
So when we talk about, so thank you, Mike, for that question firstly. Thanks a lot. It touches upon a very, very relevant issue, of course. Because while we say that a lot of hearing loss can be prevented through personal and public health strategies, but then we also need to address the needs of those who have hearing loss, who are living with hearing loss, which either is amenable to use of devices like hearing aids or implants, rehabilitation, or they prefer to use sign language. So whatever those needs may be, we need to address them. But hearing aids themselves and their cost has long been an issue of concern, and different countries have different models for their reimbursement or their coverage, but certainly not all countries. So this, as you said, Chris, it touches upon the point of equity and universal health coverage, because the very principle of universal health coverage is that people should be able to access the care they need, but without putting them at risk of, financial emaciation. So certainly this is a factor, and the World Report talks about this. It talks also about what are the policies, what kind of financial protection mechanisms and social protection mechanisms need to be in place. Because when we are talking about hearing care, we have to take a holistic view and see how this service, whether it is the requirement for a hearing aid or for rehabilitation therapy or for sign language education, this should be provided to people as part of universal health coverage and access.
So it's not just one thing. Technology can be life-changing for some people, but for the society on a whole, it's more a package of interventions.
Exactly.
Excellent. Well, thank you, Mike, for that question, and thank you, everyone, for sending in all these questions. We're going to get to a few more. Saiful Sirnwell from Bangladesh is asking, what is the effect of loud traffic on hearing? So that could be either for someone who's in traffic all the time or someone who has to work outdoors. Is this a factor?
Saiful, thanks a lot. And you know, this is something which is very close to my heart because I did study it quite a bit. And you would be surprised, perhaps, Chris, to know that in some of the crossings in huge metros, the noise levels can reach what is 104 decibels. So that is the kind of noise level which a human ear can tolerate only for about 5 minutes or less. Yeah. I think I'm wrong, it's less than a minute. So it's really a short interval of time that you can tolerate this kind of sound. The point being that when the intensity level is so high, it can put you at risk if you are spending a lot of time in that traffic, or if you are working, let's say, in a noisy crossing. So if you're working in if you're a traffic policeman who's at a noisy crossing for several hours a day, certainly it poses a huge risk. Most of the crossings, of course, don't have such high levels, so everywhere in the world, in which case traffic noise is more a cause of annoyance than of hearing loss. But where the levels go very high because the volume of traffic is very high or because the road surfaces are not adequate, in that case certainly it can pose a risk for one's hearing.
If we look back to something you were talking about before, young people and the effect of listening to loud music over long periods of time, is that something that builds over years and then the effect is heard much later, or is this something that can have an impact on young people right away if they're listening to a lot of music today?
Yeah, thanks, Chris. So it's really about how much, how long, so how much sound are you consuming? It's really about that. And yes, it doesn't, at times, if you're exposed to a very loud sound, so let's say you were you were standing next to a speaker which kind of burst into your ear, that can cause temporary or even permanent hearing loss at that point, as you've seen also many, you know, in people who are exposed to certain explosions or firearms. But hearing loss, typically when you're listening to loud music, it develops over time. Now, how much time that takes, whether that is a couple of years or it is 5 years or 10 years, would depend on how much you're consuming. We had some time back a young man who came to one of our meetings, and he spoke about how he used to listen to his music while working out, and over a period of a couple of years, his hearing, and suddenly he felt that he just couldn't hear. So, you know, though that does happen, it happens also in young people. As a matter of fact, some research from a high-income country showed a couple of years back showed that 16% of their population, young population, this was under 19s, had a hearing curve very typical of early onset noise-induced hearing loss. So that is quite a big proportion for that age.
I remember when I was a young person, a teenager, and I would go to rock concerts and music concerts in Canada where I grew up. And then you would get home at night and your ears would be ringing all night long, ringing. And it would go away. So no problems. But it's not something that goes away. And for some people, the ringing in the ears never leaves, and it can be quite affect
so
their
the
lives.
ringing in the ear is actually can often be the first indication that you're developing a hearing loss. So if you have a ringing in the ear which is persisting or for even a little bit longer than usual, you need to take that as a warning sign that next time you go to a concert, make sure you carry earplugs. Even if they look at that point uncool, maybe you can make them cool. So that is a message for the young
I think the way that now they give out earplugs at many concerts is helping that, I think. You don't have to go buy them yourself.
Yeah, you
They're
don't
often
have to
free.
buy them.
So people are asking us on social media, what should we do? If I'm concerned about my hearing, what's the right steps to take?
Yeah, so, well, if you're concerned about your hearing, the first thing to do is to get it checked or to check it yourself. So actually there are a number of apps which are currently available, which you can download free of cost on your phones and so on. We have, WHO has an app called the Hear Who. Hear Who app, which is available both on iOS devices and on Android devices. It's a completely free app, and what it allows you to do is it allows you to check your hearing. So at any point in time, all you need is 5 minutes and a relatively quiet place, your smartphone or a tablet or something similar, and a pair of earphones or headphones which you connect with it. So just sit in that quiet corner, take that 5 minutes and check your hearing. So it will give you your score, and if your score is below a certain level, that's when you need to go and get your hearing checked, or to be, and you can also, if it is fine, that's excellent. You can keep a record on it and you can monitor it also over time to see how you're doing and in case you're going down.
Thank you so much. Dr. Shelly Chahda, our expert on hearing loss prevention, and welcome to all those who are joining us a little bit late for a special Social Media Live on the eve of World Hearing Day and on the eve of WHO's first ever World Report on Hearing. Something that's on a lot of people's minds, I know, during the last year has been the COVID pandemic. I'm wondering if you could talk a little bit to our viewers about specific issues that has for those who have hearing loss in terms of changing in their work environments, in terms of everyone being on video conference calls instead, in terms of other aspects. Shelly, if you don't mind.
Yeah, so thanks a lot, Chris, because a number of surveys which have been done not by WHO, I quote external surveys here, have shown that the pandemic has had a lot of adverse impact. So that's the secondary effect of the pandemic on people with hearing loss. Because as you know now, everybody is wearing masks, which is wonderful because they are what is going to ultimately help us protect ourselves. But people who are hard of hearing, especially those who are deaf, they rely a lot on lip reading. So, and lip reading gets masked by masks. so that is posing a big challenge also with the physical distancing. So with a physical distance of let's say 2 meters, and then wearing a mask makes it very challenging at times even for someone with normal hearing to understand, but then especially for people with hearing loss, it is posing a big challenge. And while Zoom meetings have in a way made things more accessible, because at least people can at times be without masks on those meetings, and you can turn up the volume so you can control that and so on. But what you lose over there as opposed to a face-to-face interaction is the body language and these things which form a very important part of communication. So that also poses a slight challenge, but I must say that it has allowed people to remain connected, so we cannot complain about it. But indeed, the pandemic that we are going through is very challenging for people with hearing loss. Just to show you, if I may, so there are many places research is ongoing, and in some places they've already developed masks like this, which have a clear panel so that lips can be read. So where such masks are approved for use, and it is not yet available. I know that's a limitation in every place, but where they are available and they are approved, they can be used in our day-to-day interactions. Because the thing about hearing loss is you don't know who has hearing loss. It's invisible. So unless anybody that you're speaking to could potentially have hearing loss. So where it is possible, it makes sense to use these.
Indeed. And so this is another important message that we talk about a lot, about solidarity, that it's something we need to look out for each other in these times. In terms of access to care, is that something that's been affected in terms of people being able to get testing, in terms of people being able to get their hearing aids updated?
Yeah.
Has that been an issue?
So that's been an issue across the board. So WHO, last year we studied the impact on various non-communicable diseases, services for various diseases, and we studied also the impact on rehabilitation services for different conditions. And what we found was that about 74% of the countries which responded, in about 155 countries did respond to this survey, they reported that there was disruption in rehabilitation services. So certainly services for diagnosis, for intervention, these have been affected across the board. Yeah.
Thank you, Shelley. And thank you everyone for your questions. Let's get to a few more. We have one from Facebook talking about very young children, babies. Are they affected by loud noises and over a long period of time? And is hearing loss an issue for them?
So yes, indeed. Absolutely, you're right. Thank you for raising that very important point. Because babies can have hearing loss due to a number of causes, but yes, exposure to loud sounds is one of them. There has been a lot of research even to show that the noise at times of a noisy nursery, because there's a lot of equipment and that can be quite noisy at times, and even that could have, if the baby is there for a prolonged period, have an impact. So just to show that yes, indeed, babies' ears are not in any way soundproof. Yeah.
Excellent. Thank you for that answer. We have a viewer on Facebook, Shailaja Matri, who's asking us about the trend in India. I wonder if we could talk us a little bit about that, if you have any details on India in terms of it's a very large subcontinent, it's a lot of people.
Yes,
but
indeed.
So
you mean trends in hearing loss?
Hearing loss, yes.
Yeah, okay. Thank you, Shailaja. So I can pronounce that better
than me, indeed.
Thanks, Shailaja, for that question. So, and I'm from India, so I know that in India, the number of people with hearing loss was about 60 million. This is a few years back. We are talking about disabling hearing loss. And this number could have changed because the country has been investing in a national strategy. So I'm not aware exactly of the current situation, but I do know that a large study was actually ongoing in India and is probably nearing completion or has been completed, which was to assess the prevalence of hearing loss and see if there has been any change from the earlier trend. So I think maybe in a few more years that assessment will be available, or maybe even less, maybe even earlier.
Okay.
So, yeah.
Thank you so much. We're getting quite a few questions on picking up on something you mentioned on the cotton swabs in the ear. So if we're not supposed to be putting cotton swabs in our ear, if I understand you correctly, how should we be taking care of our ears to make sure they're clean and that we don't damage them further?
Thank you for taking that question, Chris. So actually, this is a very favorite topic of mine, because I like to say the ear is a self-cleaning organ. You really don't need to clean it from inside, just as you don't clean your, throat from inside here or something. So you don't need to clean the ear from inside here. All you need to clean is this shell-shaped outer structure, and that you can do. You can use a cotton bud for that, no problem. Just don't put it inside this little hole here. And you can use also a tissue paper or a soft handkerchief, a soft tissue paper, and you can just clean it from here after because that is where the dirt is likely to gather. The dirt which you suspect goes inside, actually that is dirt coming out from inside the ear. That is the normal mechanism of ear to clean itself, is to shed that wax. What happens when you use a earbud is you push it back. So you push what is coming out, you push it back. So actually you are acting against nature, and that is what you don't want to be doing.
Do you have any experience with these ear candles that some people use, or some you see for sale sometimes in some shops? Are those actually useful, or are they not doing anything?
So the simple answer to that, Chris, is please don't use them. So don't use them. Don't go also to any untrained person to have your ears cleaned. They're very popular in some parts of the world. I'm aware of that. Please don't do that. So don't use an earbud for sure. If you suspect that you have wax impaction in your ear, you need to visit any physician who can look into your ear and tell you if it is there, and then give you some drops for their removal, or to remove it by a simple suction.
Thank you so much, and thank you to everyone for these questions. Now we got one from LinkedIn. Can surgery for hearing loss improve hearing dramatically, or does it maintain the level of hearing one currently has? So does it make things worse?
Yeah. Thanks. Thank you for that question. But I would say that the answer to this is pretty complex, because it would depend on what you're operating for. There is not, hearing loss can have many causes. So it can be caused by, as I said, ear infections. And you can treat that ear infection with a ear surgery. For example, if there is a rupture in the eardrum, it can be repaired. And after a few months even, the person can have, regain a similar level of hearing as before. But then you also have surgery like cochlear implant surgery. So that is another level of surgery, which is for a person who's deaf, and you implant a device. The success would depend upon a number of factors. So it's a bit of a complicated question to answer, because there is not just one cause which leads to hearing loss. What cannot be corrected by surgery is hearing loss due to noise, or hearing loss which happens due to age. If it is severe, we can use implants or hearing aids to augment your hearing, but it's not really something which cures hearing loss.
Are these surgeries expensive? Are they accessible to people, or generally not?
So surgeries for ear infections are, the costs vary from different countries based on their own economic range. But they are available, but not very accessible in every place, mainly because of the limitation of human resources, because trained ENT surgeons are scarce in most parts of the world. And cochlear implant surgery is also not so accessible, because it carries a huge cost. It's fairly expensive, and also because training for cochlear implantation is, again, not easily available. So the human resource is a big factor in limiting access to care.
Thank you so much. So tomorrow in this very room, you're going to be launching the first ever WHO World Report on Hearing. I'm wondering if you could talk a little bit about who's been involved in that report. Do we work with partners on that? And share a little bit about what people can look forward to. And they can join tomorrow, I think. It's going to be live on all our social media platforms and on the WHO website, I believe.
Yeah, thank you. Thanks, Chris. So this report actually is a WHO report, but we have, I think, around 200 people and organizations which have contributed to this report in various ways. So when I say various ways, on one hand is the academic content of the report. So that is to bring in, do the background research, do systematic reviews, find papers, and so on. But then there is also a lot of contribution of examples of experiences of how countries and across the world, and you'll find examples from all of the regions, about how countries are taking steps to overcome some of these challenges, like the human resource challenge, or like the challenge of cost. So what are the steps different countries have put in place to overcome these challenges? So a lot of countries, a lot of people, experts have contributed these examples and their experiences and shared them with us. And then we have had a much wider input into this report, on one hand from our member states through various consultations in all the regions that we've held from time to time, and also of our partners like professional associations, associations of people who are hard of hearing, people who are deaf, So everybody has contributed to this report in more ways than one. So it's really a very collective effort of the, I would say, the ear and hearing care global community to put this together.
Thank you so much. And this will be available online tomorrow, I believe. Is that where people can find out more information?
It is actually, I think, available. It's going to be available from today evening onwards.
Excellent.
So the embargo
Excellent.
lifts, and it will be accessible to all.
On www.who.int. As well, people can find information on the Make Listening Safe initiative. I wonder if you could talk a little bit about that briefly.
Yeah, thanks. Thanks, Chris. So this initiative was, I mentioned earlier in our discussion that over 1 billion young people are at risk of hearing loss simply because of the way they are listening to music. So, and while how we listen is our personal responsibility, you know, ultimately I can choose to listen at a high volume or low volume, but we believe that it is the responsibility of governments, of international health organizations like WHO, and other authorities to create an environment where people can be enabled to practice safe listening, so they can understand that this poses a risk to their hearing, and they have tools which can facilitate them to practice safe listening. So for this purpose, WHO is working on one hand to raise awareness, targeting the different age groups, or not just young people, but also developing materials for the media, for school children, for governments to implement awareness programs. And at the same time, we are also looking to create those tools. So I mentioned earlier that we already created some recommendations about what should be in a device, so that it is safe for listening. And some of the leading smartphone companies are already implementing these recommendations in their devices, so people can not just think, oh, I need to lower my volume, but they can see on their device, is this volume good for me? Maybe I like to listen a little loud, but I want to listen for only half an hour. That's my choice, as opposed to listening at a softer volume and for 4 hours a day. So that's my choice, and you can make that choice. So based on these tools, so that is what we want to provide to people.
Indeed, my phone the other day was giving me a message, I've been listening to music too loud, too long, it was telling me. So the technology does work. Yeah. So thank you everyone for joining us. We have had people from around the world. We're going to go over a little bit of a list here. Sri Lanka, India, Canada, Jordan, Angola, Tanzania, Uganda, Kenya, Nigeria, Cambodia, South Africa, Cambodia again, Guinea, Indonesia, Ecuador, Nepal, Pakistan, Bangladesh, Vietnam, Turkey, Rwanda, Nigeria, Cameroon, Romania, Lebanon, India, Canada, Argentina, Ireland, USA, Namibia, Turkey, Algeria, Greece, Mexico, Germany, Zimbabwe, Morocco, Italy, the Gambia, and many, many more. Thank you so much, everyone, for joining us. With people around the world, this is a global issue. I'm wondering, Shelley, if you could just sum up again, ahead of World Hearing Day, the main findings of WHO's new report on hearing, first ever, being launched tomorrow.
Thanks, Chris, for that opportunity to sum up. So, in summary, I would just like to say that the fact that so many people continue to have unaddressed hearing loss in this day and age is really unacceptable. So that is what the report shows, because we have such wonderful means both to prevent hearing loss and to also address it at all stages of the life. So countries need to act, and countries need to act, partners need to act, and we personally also need to take responsibility for our hearing to make sure that we can maintain good hearing across the life course, because hearing across the life is possible. So that is the message in a nutshell which the World Report brings.
Perfect. Thank you so much, Dr. Shadha. And thank you so much for your work, and to the team and to our partners working on this issue to make hearing care for all accessible reality. Thank you to our audience for joining us today. This is a series of live events that we have on social media. We hope you can join us soon, tomorrow. We hope an event talking about COVID-19. I think probably around 5 o'clock European time. Join us for that. Thank you again, and we look forward to talking to you soon.
And join us at 11 a.m. for the launch of the World Report on Hearing,
Indeed.
and you will have a very interesting discussion. And not just discussion, you'll have some fun and music as well.
Excellent. So 11 o'clock European time on WHO website. There's more information in all languages
Yes.
with caption feed as well.
Yes.
Thank you so much, Dr. Chadha. Thank you all to our audience for joining us. This is Chris Black from the Communications Department, coming to you live from Geneva headquarters, Geneva, Switzerland. Have a good afternoon, good evening, and a good morning.
Thank you.